So let's start. Here we go. We see our graph with our number of cases in almost 46 million cases total we have, with 743,410 deaths. We're at 78% of people 12 and over being vaccinated with at least one vaccine, and our U.S. is still in the high transmission risk category, as the states are still in red. We see a tiny little blip here on the end of it going up from October 24th until the 31st, which this is the last date on here. We have a slight increase, very, very slight. I'm hoping that's just a blip, but we got to keep our eye on it. This is what we look like. We're now out to, this is as of October 28th. We see that we are just above our lowest, which was on June the 11th, where we had 660 cases per week. This is this little dip right here on June 11th, and we're almost there. We're just below the line. We're at 879 cases per week. So we're almost where we were down in June. We got to keep going down. The idea is that we go down as far as possible so that when we have our next wave in the winter, that we'll be able to have a small wave and not a large wave. So we need to make this continue to go down. Of course, we still have our Delta, which is what's causing still a lot of people becoming positive and causing breakthroughs. So please don't let our guard down. These are our numbers. You can see that we are now at 3.0 new case positivity. So we've been below 5 now for several weeks. That is very good. We went down another 0.4 points since last week, and this is where we were at our last Board of County Commission meeting. We were at 4.1, and our number of cases per 100,000, we were at 96.2. We're down for 59.1. And we're still at 75%. We have not moved this. The other counties have gone up a bit, but we have not moved our 75%, even though we have vaccinated now 981,296 people. But, you know, we still have a ways to go. This is the important chart that I want everybody to keep in mind, because there's a lot of talk in terms of what metrics people are using to make decisions in the community. We are still in the substantial category for this reason. Look at the numbers here. You have to look at these two numbers, the number of cases per 100,000 in the past 7 days, as well as our new case positivity for the last 7 days. So we're at 3.0, so we're below the 5. We are in the low range for testing, but we're still in the substantial because we are at 59.1. So we have to go below 50. Now, I told you that we were going down about 30 points per week, and that is true. So hopefully, by the time you have your next Board of County Commission meeting, we will actually have fallen into the moderate. I am suggesting that we use at least 2 to 4 weeks to be in there to make sure that we're staying in that direction. Obviously, we've been coming down, and we probably won't start going up again until after the holidays, when people start coming down, we start having traffic and traveling, and we'll probably see the numbers going up after that. So let's keep this going down for a little bit longer so that we can be in good shape to survive the winter. This is what we look like right now in terms of our state. You can see a lot more yellow, and you can actually see a little bit of blue. We got Okeechobee County has turned blue. That's in the low range. Baker up above, that's Baker right there, and then next to it we have Madison. All 5 of our metro counties are now all under the substantial. They've got out of the high range. So we got Dade, Broward, Palm Beach County, obviously. We got Hillsborough and Orange. We're all in substantial now. And there are 2 counties that have turned red. I don't know if you can see it very good, but Monroe County and Glades, have actually increased to high. So there'll be a little bit of adjustments, I imagine, as we go around, but you can definitely see a lot more yellow and no more red that we were having at our last meeting. So things are definitely trending in the right direction. This is where we're kind of stuck. We're stuck at this 75%. We're still seeing the same numbers here. Broward went up 1%. They're at 83% in terms of total vaccinations, and Data's at 94. With they went up 2 points. We're still vaccinating. We're still doing a lot of outreach, but we're still in that percentage. The other big thing now is that the FDA has authorized the use of the Pfizer vaccine for children 5 to 11 years old. The Advisory Committee on Immunization Practice is meeting today. I don't know if we have an announcement yet, but they will be recommending for this group to be able to get vaccinated. We'll be sending out the vaccines. We've already ordered ours. We're waiting for shipment to come in as soon as this is done. And of course, it'll come with the paperwork and everything else that we need to move on this. We have our teams ready to start vaccinating. The physicians' offices have also ordered their vaccine, and we are willing to help anybody that needs help with this. The pharmacies will be vaccinating the children also, and so we're recommending that everybody be ready. I recommend highly that people make appointments so they're not waiting in line. There's no need to wait in line. There's plenty of vaccine, and it will be distributed. So if you make your appointments, you'll be able to have it without waiting for lines. So in summary, we still have the Delta variant that's causing problems, being more contagious and causing breakthrough cases. Vaccinations remain the most important tool to stop the spread of this virus and to save lives. Hospitalizations have continued to decrease. Our hospitals here have done a phenomenal job. They're really my heroes in all this. They have continued to work and take care of the patients unbelievably. We need to be prepared for a winter spike, so let's not let our guard down. We need to get to moderate in order to ride the winter resurgence. So please, I continue to urge people who have not been vaccinated to do so. Don't forget getting monoclonal therapy if you become positive to COVID, especially the elderly or any population that is at risk, even if you're vaccinated. You want to be able to stay out of the hospital and not die from this. So the monoclonal therapy is available. We still have our monoclonal site up at the Westgate Recreation Center. I don't know how long it'll be there, but we're going to try to keep it as long as possible. But there's other places here in Palm Beach County that you can also have access, and your doctors can also order it and make sure that you get it either through their offices or through the other infusion sites that are here in the county.